The muscles used when opening a jar include flexor pollicis longus, flexor pollicis brevis, abductor pollicis brevis, adductor pollicis, and opponens pollicis. A high five uses anterior, lateral, and posterior deltoid muscles, biceps brachii, triceps brachii, and rotator cuff muscles. Some of the muscles used during a wave include the dorsal and palmar interossi, adductor pollicis longus, extensor digiti minimi, flexor digitorum profundus, and flexor pollicis longus with the hand. The muscles used when typing on a keyboard include flexor digitorum superficialis and profundus, extensor digitorum communis, abductor pollicis brevis, flexor pollicis brevis, and more. The muscles used when winking include orbicularis oculi and levator palpebrae superiorus. Muscles used when opening a marker include wrist flexor and extensor muscles, flexor pollicis longus and brevis, abductor pollicis brevis, and adductor pollicis. The muscles used whenever taking a deep breath include the diaphragm and external intercostals. The muscles used when reaching up include deltoids, trapezius, serratus anterior, the rotator cuff muscles, bicep brachii, triceps brachii, latissimus dorsi, and teres major.
Arm curl. The biceps brachii flexes the elbow and supinates the forearm. The brachioradialis aids in elbow flexion, and the brachialis aids in elbow flexion. Pat on the back. The deltoid raises and moves the arm backward and outward. The triceps brachii extends the elbow to straighten the arm during the pat. The latissimus dorsi assists in shoulder extension and adduction. The rhomboids and trapezius stabilize the shoulder blade and upper back, and the rotator cuff group, the infraspinatus and teres minor, stabilize the shoulder during movement. Eyebrow raise. The frontalis elevates the eyebrows and wrinkles the forehead. Neck flexion. The sternocleidomastoid, or the SCM, flexes the neck and rotates the head to the opposite side. The longus colli flexes the neck and helps stabilize the cervical spine. The longus capitis assists in flexing the head and upper cervical spine, and the anterior scalene aids in neck flexion and elevates the first rib during breathing. Knee lift. The iliopsoas major hip flexor that lifts the thigh towards the torso. The rectus femoris assists in hip flexion and extends the knee. The sartorius flexes, abducts, and laterally rotates the thigh and flexes the knee. And the tensor fascia latae, or the TFL, assists in hip flexion and stabilizes the pelvis during movement. Shoulder shrug. The trapezius elevates the shoulders and stabilizes the neck and upper back. The levator scapulae assists in elevating the scapula and stabilizing the neck. And the rhomboids, minor and major, retract and stabilize the scapula during shoulder movement. Calf raises. The gastrocnemius is a powerful plantar flexor. The soleus assists in plantar flexion. The plantaris is a minor contributor to plantar flexion and assists the gastrocnemius. A snap. The flexor digitorum superficialis flexes the middle phalanges of the fingers. The flexor pollicis longus flexes the thumb. Opponens pollicis allows the thumb to oppose the fingers, and lubricals and interossae fine motor control of finger positioning and flexion. The extensor digitorum extends the fingers.